Hey everybody, we're going to be talking about the anatomy of the heart today. We're looking at the heart from the anterior side. I can tell it's the anterior side because I don't really see the pulmonary veins and arteries very well here. To see them, you'd actually have to turn the heart over and take a look at them. As well as the pulmonary trunk is in front of the aorta on the anterior side, so I can tell that this is the anterior. And when we look at the heart, the pointy part or the inferior part of the heart is actually called the apex, and the part where all the vessels, the blood vessels here are coming out, is called the base. Another point is that when you are looking at the heart and you're looking at right and left sides, the right side is actually the side that would be on the left on your computer screen. When we talk about right and left, we're talking about from the perspective of the patient. So if there was a patient here and we're looking at their heart, this would actually be their right side. So we call this the right and this the left side of the heart. I'm going to open that up now. The other thing that I want you to take note of is if you look at the amount of muscle tissue, this is the interventricular septum. So it's the septum that's between the two ventricles at the apex of the heart down here. It's got a lot of muscle in it. And you can see there's a lot of muscle on this side of the heart, the left side of the heart, but a lot less muscle on the right side of the heart. So whenever you're trying to orient yourself which chamber you're looking at, the one that's on the left is going to have a lot more muscle. And it makes sense because blood from the right side of the heart is only going to the lungs, which would be like right here on either side of the heart. They're really close. But blood from the left side of the heart, from the left ventricle, has to go to the entire body. So we really want to give it a lot more force to get it, wherever it needs to go, way up to your head or way down to your feet. By convention, when we talk about blood flow through the heart, we usually start with the veins that are bringing blood back from the body. So this is deoxygenated blood coming back from the body. And it's either going to come in on the superior vena cava, a vein, or the inferior vena cava, a vein. So veins always bring blood back to the heart. When the blood comes back in, both of those vessels are going to pool their blood here in the right atrium. From the right atrium, the blood is going to go through this valve. This is called an atrioventricular valve or an AV valve. And this particular valve is called the tricuspid valve. It has little strings attached to the bottom of the valve, and those strings are called the chordae tendineae, and they're attached to muscles that are in the walls of the ventricles. These are called papillary muscles. So when the ventricle contracts and starts to increase the amount of pressure inside the heart, we don't want the blood going backwards. We don't want it to go back into the atrium. So these strings hold the valve closed so it doesn't get blown backward like an umbrella. Instead, what we want is all the blood that's in the right ventricle to be pushed up through this valve and leave the heart. Now remember, this is deoxygenated blood, so we want to send it to the lungs. This is a different type of valve. You can see it looks quite different. You've got 3 cusps here as opposed to all the strings and everything. This valve is called a semilunar valve. The name of this particular valve is the pulmonary valve. It's called the pulmonary valve because it leads into the pulmonary trunk. Okay? This is an artery. It's an artery because it's leaving the heart. Even though it's carrying deoxygenated blood, it's still an artery. So we have the pulmonary trunk, and then we have the left and the right pulmonary arteries. Those are going to take deoxygenated blood from the heart, take them to the lungs, allow the blood to become oxygenated, and then it's going to come back to the heart again. But it's going to come back to the opposite side of the heart. So when it comes back, it's going to come back in pulmonary veins. Remember, veins bring blood back to the heart. So these two and these two are the pulmonary veins. The left pulmonary veins, the right pulmonary veins, because they're bringing blood back to the heart. And they're going to bring them back to the left atrium. The blood will then go through this valve. Now, this is the same type of valve as that one over there, But this valve is actually called the bicuspid valve. If you're having trouble remembering which is which, tricuspid and bicuspid, maybe you might want to try it before you buy it. So bicuspid is the second one that the blood's going to go through. It's also got chordae tendineae, and it's also got some papillary muscles that will help hold that valve closed during ventricular contraction. When the left ventricle contracts, it's going to go through this type of valve. This is, again, a semilunar valve. This one's called named after the vessel that it releases into. So this is the aorta. This would be the aortic valve. The blood will go into the ascending aorta, and it continue in the descending aorta and go to the body structures that are below the heart, or it could go into one of these three arteries, okay? To remember the names of the arteries that are available after leaving the heart, we can talk about our ABCs. A is for aorta, so the blood can just stay in the aorta. B would be this first branch off of the aorta. That's called the brachiocephalic artery. So brachio means arm, and cephalic means head. So this is actually going to bring blood to the right arm and right side of the head, oxygenated blood. So we've got our A, our B, this would be our C. So this is going to be the left common carotid. This is actually going to go up the left side of the head. And then the last one would be S for ABCs. This is your S. This is going to be the left subclavian. We all know where the clavicle is. So this is going to go under the clavicle, subclavian, and continue on to the left arm. I think that's it for all of the structures that are on the on this particular model. Hope that helped. See you later.